The shortage of cholera vaccines has seen outbreaks worsening in at least 16 African countries. In January this year alone, nearly 41,000 cases and 775 deaths have been reported. Doctors Without Borders is working around the clock to try and stem the tide, and there are several challenges, including the high demand for the oral cholera vaccine and the low supply. Let's talk about this now in efforts to curb the outbreak with Emergency Coordinator for Zambia MSF, Carla Melki. Carla, good morning, and thank you for joining us. This is a grim situation. It is dangerous. When you think, though, that it's quite easy to deal with cholera and to fix it through rehydration, barring extreme cases where antibiotics are necessary, why is it difficult even for basic access to what's needed to deal with cholera?
So yeah, actually is really what you mentioned. The most important thing is to react very quickly. And there is exactly two things to do simultaneously. From one side, giving access for this easy treatment of rehydration with like a close in the community and in, let's say, general center of cholera treatment. But at the same time, is how to identify in the community the best way and the sources of infection. Because it can be multiple. You can have like, for sure, water and sanitation are the most cases, but you have also this human transmission. So the community engagement, the involvement of volunteers, of community-based leaders, is one of the key elements to stop spreading of the outbreak and at the same time providing an increase of access to treatments.
Yeah, as we said there in the introduction, high demand, low supply. Maybe we can deal with the question right now of stockpiling. We understand that there is a deadline looming. The stockpiles are bound to be finished or run dry in the middle of this month. There's only one active vaccine manufacturer that's able to provide this. We certainly need to speed up the ability, as we've said before in other areas, for Africa to produce its own vaccines and to distribute that quickly.
For sure, one of the main key is to start and to increase strongly the production of vaccine in order to stop the outbreak and spread of the outbreaks. For example, in Zambia here, in Lusaka, they received 1.9 million of doses, which was a good example of quick response. But then there is no enough vaccine to cover other regions. For example, actually, I'm based in the Copperbelt region, and there is no access to vaccine because it was for sure focused in Lusaka, where they were the main epicenter of the outbreak, but there is spread everywhere in the region, and there is a need to increase this production quickly because it has a great effect to stop the spread that is now a regional situation.
So we know the cause, and this is common, contamination of the principal water sources, or as you say, spread from one person to the next. But this is happening, simultaneously in several large regions. We're talking about Central and Southern Africa. What's leading to this? Is it a breakdown of services? What's at the heart of it? I know it's not necessarily MSF's core, but, for us to be able to understand what's driving these high rates simultaneously.
For sure, the question of the living conditions is one of the key things. So we are going for the infrastructure. What kind of the sanitation, the water supply provision. So if we have no access to chlorinated water, it's easy to have a quick spread of this disease. So for sure, infrastructure will be one of the key elements. And the second part will be access to health, because at a certain point, if you are able to have a quick access, you will stop the human transmission.
What you're sharing with us, Carla, is so concerning, because if there are these deep infrastructural problems, they're not going to disappear tomorrow. You have an issue where you have a limited amount of vaccines to be able to distribute to people. And you also have the prospect of this outbreak worsening and widening in scope. So what's to be done? What's needed right now?
But what I have to say is that Ministry of Health that have been working on this outbreak were very reactive and has a great management with the support of their partners. So the question mark is more on a global reflection toward like infrastructure, toward like access to health, and should be, for example, one of our calls to be free and having these vaccines available. So then there is a kind of advocacy to be done regarding productions, but also to give enough funds to the Ministry of Health and to the infrastructures department to be able to have, let's say, a more long-term approach to this kind of situation.
All right. Well, thanks for joining us this morning just to share light on this crisis and a lot of people in danger still today and in the weeks to come if nothing is done urgently in terms of the provision of those vaccines or support to those governments. So thank you for highlighting that, Carla, and putting it on the radar. Carla Melki is the emergency coordinator for MSF in Zambia.